Hi, hello everyone, how are you? Welcome to another video for MRCS exam, and this is question and answer session which will help you a lot to prepare yourself for MRCS exam and pass the MRCS exam very easily. So here the question. First of all, read the question very carefully and find out the key points here. So what is the most important structure involved in supporting the uterus? Here are the options. They are round ligament, broad ligament, uterosacral ligament, cardinal ligament, and central perineal tendon. So here, the key points: most important structure involved in supporting the uterus. We know that this uterus, it lies in the pelvic cavity. So when a person stand, uterus should be supported from the gravitational force, or it will be descend down. So let's see first of all the uterus. We can see this is a uterus which present in a female, and it present in the pelvic cavity, and it is supported by the different structure preventing going downwards of the uterus. And here we can see different part of the uterus here, such as here the body, ovary, fallopian tube, cervix, external internal os vagina, and the labia minorum. So let's see the structure which support the uterus. So here we can see there is a different structure, and this structure support the uterus from descent down of the uterus. And here we can see the central tendon of the perineum is subcutaneous. So here there is the central tendon of the perineum, and we can see here the different parts which support the uterus. Here we can see first of all the central tendon here, and this is the most important for support the uterus. We can see some other structures such as the deep transverse perineal muscle, and here the external urethral sphincter and urethral opening and vaginal opening also. So here we can see a table. This is the support of a uterus, primary supports, and here we can see the fibrous support, the fibromuscular, pelvic diaphragm, perineal body, and urogenital diaphragm. The perineal body, it also known as central perineal tendon, and it is the most important support for the uterus. And we also can see some ligaments such as pubocervical ligament, transverse cervical ligament, uterosacral ligament, and some fascia, endopelvic fascia, vesico-vaginal fascia, and rectovaginal fascia, and also the normal axis of the uterus, which is the anteverted, anteplexed uterus, and round ligament. So they are all contribute in the support of the uterus. So again, pelvic diaphragm, perineal body, which is central perineal tendon, urogenital diaphragm, pubocervical ligament, transverse cervical ligament, and uterosacral ligament, and some fascia, endopelvic fascia, vesico-vaginal fascia, and rectovaginal fascia, and uterine axis, round ligament. So here our final answer is central perineal tendon, and this central perineal tendon is the most important structure involving in the supporting of the uterus. So our final answer is central perineal tendon. Other ligaments such as cardinal ligament, uterosacral ligament, broad ligament, round ligament, they also support the uterus, but the most important is the central perineal tendon. Thank you all.